I'm very pleased to be here, and I want to thank you and I want to thank your President and your CEO for inviting me to address you. It's only a year since we last spoke, and yet in some ways it seems like eons. I was having a quick look at the speech last year, and we were talking about setting up the SDU, and we were talking about nurse prescribing, and a lot of what we talked about has come to pass. And I think, and I hope, I speak for us both when I say I believe our relationship is much improved. I think we've stopped fighting about and disputing the numbers of people on trolleys. We accept our numbers. Not that the number, no, but I mean, and how we measure them and that. And I think that's been important, and I think that's helped us focus on dealing with the problem rather than disputing the figures. And there are still far too many people who have to wait on trolleys in our emergency departments. But the numbers have improved. And we want to move away from the situation where we're counting the number of people on trolleys in the morning to the real patient experience, where from the time you enter the emergency department to the time you leave shouldn't be longer than 9 hours for all people, and under 6 hours for 95%. And I know that great work has been done, and I know the huge challenges that you have faced and we have faced, both as an economy but also as a health service. We've taken 2.5 billion out of our health budget over the last 3 years, including the money to come out this year. We've lost 4,515 staff since September. And despite that, because of your hard work, in cooperation with the SDU and the clinical programmes, we've managed to maintain the improvement in the numbers of people who have to wait on trolleys. It's still too many, as I said, and we want to do more. And when I was meeting with Liam and Sheila inside, they pointed out about the new role for nurses and much of the work that nurses can do. And I'm very much listening to that because it fits very well with what I want to see happen. And that's the underlying principle, that we want the patient treated at the lowest level of complexity that's safe, timely, efficient, and as near to home as possible. And as others put it, it's about treating the patient in the right place at the right time by the right person. So there's a lot of change, and change always brings with it a degree of nervousness, whether it be doctors, nurses, pharmacists, or others, physios. But we need to use the full range of staff we have. And doctors have to let go of some of the work that they've been doing historically, because nurses can do that work. And nurses have to let go of some of the work that they do because others can do it. Healthcare assistants, physios, and others. So we know about the initiative taken in St Mary's Orthopaedic in Cork, where 40% of the people referred to the orthopaedic surgeon once they were screened by the physio were able to be treated by the physio. And that's just one small example. But I think the big improvement has been the fact that the special delivery unit, in conjunction with the clinical programmes, is listening and hearing the front line. And because of that, many of the changes that have been instituted that have allowed the improvements in performance have come from the front line and the suggestions they've made. I know that people are not happy about the budgetary constraints, but we're no longer in charge of our own sovereign financial situation. And we have regular 3-monthly checks with the Troika of the IMF, the ECB and the EU. So we're under the spotlight, and health, because it's the second biggest spender, is particularly under the spotlight. But still, as I say, we have made changes and we have made a difference. And when I say we, I do mean we. In the main, yourselves working on the front line, nurses in ED, nurses in the community, nurses in the wards. And you're the people who understand and know how the service works and what patients' needs are, and see the real suffering that patients have to endure. And certainly I, as a doctor or a Minister for Health, don't want to have hand act our part and making what's already a difficult situation worse for any patient. But I think if we act as a team, if we collaborate, if we cooperate, in a spirit of parity of esteem, there is much we have done, but there's so much more we can do. And I think if we all, as a health family, work together, we can achieve what we set out to do, which is to bring in universal health insurance so that nobody has to worry about making a choice between paying the doctor or paying their ESB bill. And as I said, we're moving now in 2012 to even more demanding targets and time. We did manage to meet in virtually every hospital bar 2 in the West the waiting time of a year, that nobody should wait longer than a year. And we want that to be 9 months this year, and that's a real challenge. But we have to meet this challenge. And we have to reorganise our hospital groups because they haven't been functioning. And I've made it very clear in the instruction that I sent out that nursing has to be part of the clinical leadership and has to be representative at executive level in the hospital group. You're the key members of the multidisciplinary team, and we need to support you in order to implement the reforms that are going to change our health service. People often say, well, this is the worst of times financially, the worst of time to try this. I don't believe that. I believe it's the best of times to do it. Because now people realise how dysfunctional the old system was. We have no choice. We have to change. And we've already changed a lot of what nurses can do in terms of the prescribing bill, which came in December last, in relation to undergraduate nursing and midwifery programmes, which should be of the highest quality, educating nurses and midwives to provide optimum care to patients and clients in a modern health service. And the review group too, from December, will be coming back to me with a report in the coming months with recommendations to inform decisions about nursing and midwifery education, having regard to the objective of the health reform programme and the future workforce needs. And I know that your leadership is very concerned that this is done in a planned way and with proper consultation. I know that there are other initiatives underway. Michael Shannon will be launching a new cancer nursing strategy in conjunction with Susan O'Reilly, Dr. Susan O'Reilly from the NCCP next week, and that there's a further initiative in relation to dementia and nursing in another fortnight. So I don't want to delay too long with you. I want to thank you for all the work you've done. I want to thank you very much on behalf of the government and of the people for the tremendous dedication that you've shown in working and maintaining a safe service through the grace period of retirements in February. And I know that nurses are held in very high esteem, and that comes because of not just your generation, but the generations before you who have given such service to people. So I would like to thank you on behalf of the government again. I look forward to working in collaboration with your leadership in expanding the work that nurses can do, in having new roles created that allow you to pursue many of the skills you have and that you can deliver excellent care and more care to patients. So I'd like to thank you very much.